Dear audience, good afternoon everyone, and thank you for the opportunity to speak here today. My name is Ildikó Szántó. I work as an anesthesiologist in Nyíregyháza, and as Zsolt mentioned, I'm a third-year PhD student at Semmelweis University at the Center for Translational Medicine. Today I will talk about intraoperative fluids and postoperative septic complications, the main focus of my PhD work. So let's start by sharing why I think this topic important. For decades, clinicians used to think that more fluid, the better. The thinking was very simple. If we give more volume, we maintain tissue perfusion. But evidence now shows that this is not true. Too much or inappropriate fluids can cause damage in microcirculation. It can even make tissue oxygenation worse. And any disturbance in fluid balance, both overload or restriction, can directly lead to organ damage, and this can increase the risk of septic complications after surgery. And now let's see some numbers. Every year, more than 300 million surgeries are performed worldwide. Almost 1 in 5 ends with a complication. That's a very huge number. Both excessive positive balance and fluid overload may cause major complications, and too restrictive therapy can lead to hypovolemia and organ dysfunction. So I think fluid therapy really matters. What we know from the literature, it's evidence that perioperative fluid therapy is fundamental for maintaining circulation, tissue perfusion, and oxygen delivery during surgery. And we know that all of the guidelines recommend the crystalloids as the first-line choice. They are safe, widely available, and supported clinical evidence, and I hope that's what most of us use in everyday clinical practice. Let's see a little bit closer to crystalloids. There are two main types of them, the balanced and unbalanced solutions, and the main difference is the concentration of chloride of them. Isotonic saline has about 154 millimole per liter chloride concentration, and that is much more higher than the normal plasma range. And there are the balanced solutions, which contains electrolytes closer to normal plasma levels, and they include some buffers like acetate or gluconate. Why is it important? Because this difference leads us to our the research gap. We still don't know whether balanced solutions or isotonic saline are better for clinical outcomes. And that's why our aim was simple. We wanted to investigate the effect of balanced solutions versus isotonic saline on postoperative complications in major surgery. We make a clinical question: is perioperative fluid therapy with balanced electrolyte solution more beneficial than isotonic saline in preventing postoperative complications? To answer this, we formatted a PICO framework where patient stands for patients who underwent major surgery. We compared balanced electrolyte solution with isotonic saline, and we looked for primary outcomes as postoperative complication rates based on the Schwarzwälder article. After it, we conducted a systematic search in the 5 main databases using both terms for saline, balanced fluid, combined with surgery and fluid therapy. And at the all of the selection process, we found 26 full-text articles met eligible criteria. And now let me share our preliminary results. The first of all is the vasopressor requirement. We use as an indicator of perioperative hemodynamic instability. We analyzed 7 randomized controlled trials, including around 2,000 patients. Overall, the need for vasopressor was 14% lower in balanced crystalloids group compared to saline, which was both statistically and clinically significant. The next outcome was the renal replacement therapy requirement after surgery. You can see, if you can see, the the latter is very low. So in larger mixed surgical trials, there was no difference between the two groups. But overall, in more than 10,000 patients, the difference was statistically not significant, but the data suggests potential benefit of balanced solutions. If we see the patients who underwent renal transplantation, we can see that there is a clear trend toward fewer cases requiring renal replacement therapy, which is almost approaching the conventional border of statistical significance. Our results was the most consistent in acid-base balance. We found that using balanced electrolyte solution have lower chloride levels, more favorable pH, and less negative base excess. Altogether, this means that balanced crystalloids can keep acid-base homeostasis better than saline. On the next figure, we show the change in intraoperative pH level in the two groups. On the left part of the table, you can see the baseline values in red dots and the end of the surgery values in green dots. With saline, the pH shifts to more acidic values during surgery, while with using balanced fluids, these values remain more stable. On the right part of the table, you can see the change from baseline with blue dots. And this shows that the blue dots in patients who got isotonic saline drop below 0, while the balanced fluids patients stay closer to 0. In other words, we can say that balanced electrolyte solution seems to support better acid-base balance than isotonic saline, which could help lower the risk of acidosis. And this slide shows an important data for us because we can see that there is no significant difference with the two groups in the amount of fluid that used in the perioperative period. That's why we can think that these results, which I mentioned earlier, is not due to the giving more or less fluid, but because the type of the fluid. This is very important because the composition of intravenous fluids are not without consequences. As Professor Melbrain, who we will hear tomorrow, notes, just one bag of saline already contains the full day sodium intake. That's exactly why I bring up this example. It shows clearly that fluid composition makes a real difference. It's not only about how much fluid we give, but also about what kind of fluid we choose. So to summarize our results, balanced crystalloids showed some important advantages, namely they can reduce the postoperative vasopressor requirement and they preserve acid-base balance better than isotonic saline. But as everybody mentioned earlier, we need further studies with more homogeneous population and with specific types of balanced solutions. Our meta-analysis included a high number of patients, making it one of the most comprehensive analysis in this topic, but the heterogeneity remains a big limitation. At the end of my presentation, I would like to thank my supervisors, Zsolt, Zoli, and Chenner, for their continuous support. And now I would like to say goodbye with the famous quote from Paul Merrick, fluids should be prescribed with the same caution and respect as any patent drug. Thank you for your kind attention.